Actually, when speaking about complications of fillers or other injected products in the mid-face, there are multiple factors. So of course, the surgeon, the surgical skills, the training is important, but also the product you use, which must be something safe, which is not cancerogenic, which is not provoking allergies, and when you can predict the result. Also, the patient herself or himself is important, the expectations, the quality of the skin, the psychological manners of the patient. And there are some other factors, let's say external factors like temperature, heat, activity, smoking. Also, I would say that the role of media is an external factor, because the internet, papers, TV can push some people towards surgery. Luckily, I didn't have any complications till now, and I hope that I won't have any other during the future. But of course, it depends on not just on the chance, but on the training. Personally, I used to do anatomical dissections, to learn about the referential points, how to find the structures, nerves, vessels, how to avoid making damage to the structures, and also the analysis of the given cases of the patients is very, very important in the avoidance. Just like when you are selecting a product, instruments, you have to use the best one from reliable sources. Actually, the most important thing is when you're treating this kind of patients is the communication, to be honest, to tell them what has happened, what you intend to do, how you want to help them, and if there's no chance to help them, you must inform them about this in a very humanistic way. And if your communication with the patients is good, then practically all of them will understand the situation, and it's very important because of their quality of life and their adaptation to this new situation. My role is the psychological orientation of the patients, and if we can make an act, then we used to do that with a team which is composed of head and neck surgeon, plastic surgeon, and psychologists. The complication, what kind of complication is that? Because the complications can be categorized acute or chronic, immediate or late complications. They can be categorized according to localization, local, regional, distant or general. The complications are not so frequent, they are rare, but they can be very, very important, like blindness, stroke, cutaneous necrosis, ulceration, and others. Blindness and neurological complication. And these complications are usually very, very acute and unforeseen. Though statistically it's quite rare, but if it happens, you must be vigilant and act immediately. So you must have some products in your office, right by your side, like hyaluronidase, and also you need to have some contacts with neurologists and ophthalmologists, and these colleagues should be able to come and help you practically immediately, because in case of blindness, the delay that gives you a chance not to lose the view is around 1 hour. But of course, much better if you can act immediately. In a minute, you inject the hyaluronidase, you call the ophthalmologist, and you act in 10, maximum 20 minutes. That's the ideal. I wouldn't say that we should not speak about mistake, because anatomy is something very, very special, and the rule of the facial anatomy is that there is no rule. So the vessels, they can be here or there, and close to the skin or deeper, so not necessarily, it's not necessarily a surgical mistake. It can be a sort of accident, a foreseen accident. So that's why before acting, you have to inform the patients, even the written consent, that statistically this, that, and that kind of complication may arrive. And the patients must know it before achieving this kind of intervention. You have to take the history of the patients, and you have to ask about pregnancy or breastfeeding, because it's not authorized to use these products in these cases. But also you must question the patients about allergies, smoking, medication. Some medical products may provoke hemorrhages in case of injection or manipulation, even in the face.